Hey, so this is our 619, section 811, person first versus identity first language debate. I am Alexis Gill, and I am the moderator and the person first prover.
Irene Diego. I am the identity first stater and the person first attacker.
I'm Daniel Urban. I am the identity first prover.
And I am Letitia Winters. I will be the person's first stater as well as the identity first attacker.
So this is our table of contents. We have our introduction slash our general position on the debate, and then that'll be followed by our staters, our person first and identity first. And then we'll have our provers, person first, identity first, attackers, person first and identity first. And then we will have our final summary. So for the introduction, the debate between person first versus identity first language has been a topic of debate for a long time now, and this issue focuses primarily on the issue of how to best describe individuals with disabilities, how to refer to them. So the person first argument focuses on putting the person first rather than their diagnosis. And this argument states that people are more than just their diagnosis. It focuses on promoting the individual first, and it aims to decrease prejudice towards members of these groups and shows that people are not defined by their disabilities. They're more than just their disability. However, the identity first side argues that having a disability is not necessarily a negative, and it's just a part of who they are, and it is an integral part of their personality that should not be hidden, and it should be addressed. So, in this debate, we will have the stater for the person first group will state their side of the argument, and then they will be followed by the identity first stater stating their side of the argument. After this, the person first prover will back up these statements using their citations, their information, their research, any relevant information they've gathered. And then after that, they will have the identity first prover present their information that they gathered to support their position. And they will each use these sources in order to strengthen their argument as much as possible before the person first attacker will counter, and they will use data, questions, citations, other information to try to disprove the other side, make their side look better. And then the identity first attacker follows up with their response to this and their own attack towards the other side. Finally, person first stater will come back to salvage their argument and summarize their position before the identity first stater does the same, salvages their own argument, their position, any concluding statements that they might have. And then I will come back and present a final summary of the debate as a whole, and we will show our sources. Each person will have a maximum of 5 minutes to present their sections. And as the moderator, I will use timers to keep track of the 5 minutes for each person's section. Each person will receive a verbal reminder when there is 1 minute remaining, and they will be verbally asked to stop at the 5 minute mark if they are still presenting at this time. If they finish ahead of this 5 minute mark, then we will go ahead and continue to our next section, and I will announce the next person who can go. Our position, by leading our interactions with person first language, we can create more positive and professional relationships with our clients. Relation to the code, we have 1.03 accountability. Behavior analysts are accountable for their actions and professional services and follow through on work commitments. When errors occur or commitments cannot be met, behavior analysts take all appropriate actions to directly address them, first in the best interest of the clients and then in the best interest of relevant parties. For 1.06, maintaining competence, behavior analysts actively engage in professional development activities to maintain and further their professional competence. Professional development activities include reading relevant literature, attending conferences and conventions, participating in workshops and other training opportunities, obtaining additional coursework, receiving coaching, consultations, supervision, or mentorship, and obtaining and maintaining appropriate professional credentials. For 1.07, cultural responsiveness and diversity, behavior analysts actively engage in professional development activities to acquire knowledge and skills related to cultural responsiveness and diversity. They continuously evaluate their own biases and ability to address the needs of individuals with diverse needs/backgrounds. Examples of this include age, disability, ethnicity, gender expression or identity, immigration status, marital or relationship status, national origin, race, religion, sexual orientation, socioeconomic status. Behavior analysts also evaluate biases of their supervisees and trainees, as well as their supervisees and trainees' ability to address the needs of individuals with diverse needs or backgrounds. So how this relates to us is for 1.03 accountability, we hold ourselves accountable for asking the client their preferences and ensuring that we are continuously mindful that we use their preferences when it comes to this kind of language. For 1.06, maintaining competence, we remain current and up to date in our knowledge of current relevant literature and best practices, including what is the acceptable language to use. For 1.07, cultural responsiveness and diversity, cultural factors or language can influence the preferences of individuals with disabilities, so it might vary depending on the individual and their culture, other factors. Increasing the knowledge that there are different preferences across individuals and ways that individuals can be affected can be taught when teaching cultural responsiveness. So we will start with the person first stater. You may go. You were muted.
In the quote you see by Stephen Shore, when you met one person with autism, you have met one person with autism. This signifies that each person with autism is different. They have different mechanisms, different abilities, and different communication styles that are unique to them. Person first language promotes individuality and inclusion, reduces negative outgroups and stereotypes, and is also recommended by the American Psychological Association. In a study by Granello et al. 2021, he surveyed 251 professionals, counselors in training. They received the Community Attitudes Towards the Mentally Ill survey, also known as CAMI. This was a 40-item self-reported survey scored on a 5-point Likert scale on attitudes. They were given 2 different tests. The first, which is they stated as a pre-modified version, is in person first language. What is stated is this person with schizophrenia. The post modified version, or the second version, is identity first, and they are identified as schizophrenics. Identity first surveys scored higher on the authoritarian and socially restrictive views. In this study, authoritarian was described as seeing people as an inferior class needing to be handled instead of a person who needs help.
Okay, for our next section, we have the identity first language stater. So you may start.
Hello. Identity first language is a form of language that emphasizes a person's disability, which they may consider a core component of who they are. This form of language involves stating a person's disability or a characteristic of their nature before addressing them using the word person. For example, an autistic individual rather than an individual with autism. There has been an increasing preference for identity first language in the autism community. Advocates for this type of language see the disorder as something fundamental to them and do not want to separate themselves from it. The increasing use of identity first language is a result of autistic individuals wanting to destigmatize the disorder by claiming it as a positive aspect of their character rather than separating it from themselves. Identity first language encourages autistic individuals to take pride in their disability and individuality. With a disorder like autism, it is hard to find your own place in the world An identity first language allows people to make their own place in the world by accepting who they are and taking pride in that.
Now for the person first prover, we have person first language in research. So, as previously mentioned, person first language is the most ethical and effective option for addressing others, and it can help to encourage inclusivity within the environment. Baker et al. 2022 found that the use of first person language led to decreased stigma towards people with disabilities. When people are referred to primarily by their labels, such as autistic person or deaf person, it can cause them to be seen as just their diagnosis or label rather than the person that they are as a whole. And this can be dehumanizing and can harm relationships with others. In some cases, this kind of bias can even lead to more difficulties when it comes to the healthcare setting. Evidence has shown a preference for person-first language. This language can help individuals avoid bias from those around them. Baker et al. 2022 found that when talking about people struggling with addiction, person-first language caused people to be kinder to these individuals and display lower rates of authoritarianism towards them. Feeling dehumanized can cause people to not seek appropriate care or support from others due to the stigma that surrounds them. Buisman et al. 2022 found that a majority of Dutch adults with autism or parents of children with autism preferred person-first language. This included 68.3% of autistic adults and 82.5% of parents with children with autism. This helps to suggest that person-first language is better and more widely recognized approach to addressing others. Waters et al. 2023 found that person-first language can reduce stigma in the medical setting. Stigma can lead to poor outcomes for individuals' health and higher rates of discrimination towards them. Person-first language can lead to a much more caring and compassionate environment. Person-first language helps separate the person from any diagnoses that they may have, and this helps to avoid bias or stereotypes that may otherwise be directed towards them and lead to worse outcomes. Bias in this manner can cause individuals to be less likely to seek medical or professional help in the first place due to fear of being inadequately cared for or improperly judged. Person-first language helps increase the dignity of individuals and ensures that they have the best and most inclusive care that is possible. So if we want to ensure respect, we need to prioritize respectful and considerate language towards others. So next we have the identity first language prover. So you may start.
Botha et al. 2021 states that language should consider the individual's right to autonomy and self-determination. In order to do this effectively, we must acknowledge the specific preferences of our clients. Many autistic individuals consider their diagnosis to be a major identifying factor and prefer identity-first language. It is important to embrace all aspects of a person's identity and avoid inadvertently reinforcing the stigma against them. Botha states the movement for identity-first language reflects the desires and efforts of the autistic and disabled community for autonomy. Autonomy and self-determination promote greater independence, a significant goal for many disabled individuals and stakeholders. The language we use not only impacts the way the larger societal community perceives individuals and their diagnoses, but how those individuals perceive their own place and level of acceptance within those communities. Additionally, according to Dwyer 2022, person-first language is rarely used in reference to non-stigmatized groups. For example, the talented musician versus the musician with talent. The intelligent professor versus the professor with intelligence. Identity-first language is conducive to more natural conversation and utilizes natural language patterns which are used in everyday interactions. Identity-first language promotes better societal understanding and integration, allowing us to converse with disabled individuals effectively and appropriately. Dwyer 2022 states that identity-first language suggests the perception of autism as a positive component of his or her identity and promotes coexistence with others. The Organization for Autism Research conducted a survey with 1,072 respondents on language preferences. Participants included self-advocates, parents, siblings and relatives, autism professionals, and educators. The survey indicated 81.4% of all participants, as well as an overwhelming majority of self-advocating individuals, have a preference for identity-first language. The data also suggests a strong preference for resources which utilize this language. 65.1% of surveyed self-advocates, 57.9% of surveyed parents, 43.2% of surveyed professionals strongly agreed that they prefer content which uses identity-first language. The language we use with autistic individuals has a strong impact on his or her perception of how we acknowledge their diagnosis. Similarly, content and resources that may be beneficial to autistic individuals risk being overlooked due to use of language which is not preferred by the individuals whom they intend to serve.
Now we have the person first attacker. You may start.
The first record of the advocacy for person first language dates back to Sweden in the late 1960s. The person first movement was largely led by parents of autistic individuals. Their official motto was "We speak for them," which can be seen as problematic because it indicates that the belief that individuals lacked the capacity to make these decisions for themselves and to speak up for themselves. Individuals are entitled to autonomy and the right to speak up for themselves, regardless of their age or disability. The people who advocate for person-first language are more often parents, peers, stakeholders, family, and friends of the individual with the disorder. That same study by Tabos et al. 2023 found that 87% of autistic individuals preferred identity-first language because it embraces all aspects of their identities. While person-first language may be appropriate in a medical sense, such as when separating a sickness from the individual, using it to refer to autistic individuals insinuates that the disorder is something that must be cured. While person-first language may be preferable in a medical sense, it may be seen as offensive when used within the autism community. For example, you are more likely to describe a sick individual as a patient with cancer or diabetes rather than a cancerous or diabetic patient. This analogy shows the contrast between the two forms of language and provides insight into how person-first language may be seen as offensive or problematic to autistic individuals. By using person-first language, are we teaching autistic individuals that their disorder is something that must be cured? Using identity-first language affirms an individual's place in this world as an autistic person and encourages their involvement in society, while person-first language may be associated with shame towards one's diagnosis.
Identity first attacker, you may go.
Labels become an issue because it matters who is doing the representing. Going in using language used by a specific group without consent of that group could risk your relationship as a professional. Also, with the changing in meaning of different words, you can risk offending that population. In a pilot study of state government employees, 60% of those participants preferred persons with disabilities. As behavioral analysts, we are professionals, and majority of the time, we do not come from the same population as those that we work with. Although it is important to build rapport with our clients, remaining professional is our obligation, and using identity first is not professional at the beginning of services. Identity first supporters will say that person first language isn't used for non-stigmatized groups. This is true, but that is because people with disabilities can also fall into these groups. An athlete with autism, for example, a poet with Down syndrome. Seeing the person does not take away from their diagnosis, but grouping all people with autism could take away from that person's personal experiences and adversities.
Now we have the person first response and summary. You may go.
A diagnosis is a part of your identity, but it is not all that you are. It is what gives you your unique views, personality, and communities with others alike. Outside of your community, who are you? A mother, a girl that has just learned to drive, a boy that his first relationship partner, a dad struggling to connect with his teenager. It is true, there isn't a cure for autism, and people with autism can't leave their diagnosis at home on the counter, as stated by the Identity First argument supporters. However, with interventions such as occupational therapy and applied behavior analysis, their livelihoods can change. They could learn skills to get a job in the community, look after themselves, and learn other life skills. Where they are now is not permanent, even if their diagnosis is. Person first language sees the person and everything that comes with them, including their diagnosis.
Identity first response and summary. You may go.
All right. Although an autism diagnosis may seem daunting to families and stakeholders, they should not treat it as something that must be cured or separated from the individual. Unless an individual is physically unable to make decisions regarding their autonomy, they should be able to choose how they want to be addressed and how they want to be perceived by the world. Identity first language destigmatizes the disability, it emphasizes its ties to the person's character, and allows individuals to accept their diagnosis as part of who they are rather than something they would rather not be associated with. Just because an individual chooses to accept their diagnosis as a part of their identity does not mean that they are neglecting other components and relationships that make them who they are, such as relationships with their family, friends, peers, and the world around them. Individuals can be autistic and still be parents, teachers, partners, and members of society who live meaningful and fulfilling lives. Although it may seem more professional to use person-first language, greeting individuals with identity-first language may lead to a more welcoming environment as it suggests acceptance of their diagnosis. When individuals grow up and learn in a more accepting environment, it promotes a more open dialogue surrounding the person's goals, abilities, and future.
Okay, so any questions that we might have for the other side or just in general about the debate?
For the person-first side, person-first language is generally the standard, but should it always be used in every situation?
While it is the standard, no, language choice should vary to fit the preferences of the individual that's being referred to. So not everybody is going to want to be referred to with person first language. There are individuals that do prefer identity first language, so you need to take that into account whenever you're addressing somebody in order to be respectful. So it just depends on the person and the situation at hand.
So many people benefit from an established sense of community in their lives, especially when rooted in shared experiences with others. So I'm thinking about, cultures surrounding people in the same line of work, people from the same geographic location, members of a sports team, religious groups, and things of that realm. So does person first language have the potential to inhibit autistic individuals' ability to establish that sense of community and support among others with autism?
So, yeah, that is a very good question. But the answer is no, because remember that person first language is not removing the diagnosis. It is simply just stating, I am a person with likes and dislikes. I have wants, I have needs. However, I still have autism. So, you're not removing anything, and they can still have that sense of community with other autists, people with autism. And I have a question for Identity First. Does Identity First language limit a person to just their label?
To that question, I would say no. Many individuals who prefer identity first language believe that their diagnosis is just a part of who they are, and without it, they would not be who they are today. Using this language can help them feel validated in their identity in a positive way.
Adding on to what Daniel says, identity first language does allow a person to accept their diagnosis as part of their nature, but it also does eliminate the stigma of their diagnosis or the disorder by bridging the gap between the person and the disorder and meshing them together.
So another question, why is the debate between person first and identity first language important?
So everybody has their own preference. It's going to change from person to person, from interaction to interaction. Somebody might want to do identity first one day, person first the next day. It's always important to address people how we should always address people based on their preferences to assure that we are validating them and respecting their decisions.
Yeah, and just to follow up with Irene, language choice can influence the thoughts and attitudes of others around individuals. The difference between a person who was previously incarcerated and a current offender can shape the way that you see them. Another question I have, how should I decide how to label myself or others?
So the best way to decide between using person first language or identity first language is to just simply ask the individual which method they prefer and honor their choice, because honoring the language that they prefer and want to use helps you to be more respectful and inclusive of their wishes, and it can create better relationships.
And just to add to that, I would say to label yourself, you should consider your own personal preferences and which specific characteristics you consider an integral part of your own identity.
So, relation to core principles, we have treat others with compassion, dignity, and respect. And this would include respecting client autonomy and their rights to choose what to be called. Which do they prefer? Would they rather have person first or identity first language? And it relates to how they prefer to be addressed, like I just said. So, ensuring their competence would include remaining up to date and making sure that we increase our knowledge of best practices and what is the acceptable language to use. For behaving with integrity, we need to hold ourselves accountable for asking the client their preferences and ensuring that we are continuously mindful that we are using these preferences. For applied, it's focused on socially significant interventions. So what is meaningful to them? Do they have a preference for what to be called? Generality, their autonomy to choose is being respected no matter where they go, and that they are able to voice their concerns across different platforms and people. Like, what would they prefer to be called? Can they do this in different settings? For technological, we can increase the knowledge that there are different preferences across individuals and ways that an individual can be affected, and this can be taught when teaching cultural responsiveness. And finally, analytic, giving the individual control over how they want to be addressed. So for our final summary, we have person first language helps encourage unbiased views of people with disabilities by showing that they are more than just their disability. It does not define them. For identity first language, it meshes a person's disability with their character and allows individuals to accept their diagnoses as a part of who they are. Peers, family members, stakeholders, colleagues, etc., should respect a person's language preferences, whether they choose to use person first language or identity first language. In the end, the debate between person first and identity first language is ultimately in the hands of the individual. They have the right to decide what the best fit for them is, and it's up to those around them to respect and honor this choice. Person first language puts the person before their label in order to emphasize that they're more than just their disability, and it does not define them. Identity first language is for those who view their condition as an integral part of who they are as a person. And the best approach to using these types of languages is to let the individual choose for themselves what feels right for them. Both sides have reasonable arguments as to why they are the best option, but the priority is on the individual, and by asking people what they prefer in their own lives, we can ensure respect and strengthen interpersonal relationships. For references, we have Baker et al. 2022, The Effect of Person-First Language on Attitudes Towards People with Addiction. We have the Behavior Analyst Certification Board 2020, Ethics Code for Behavior Analysts. We have Botha and Williams 2021, Does Language Matter? Identity First versus Person-First Language Use in Autism Research, a response to Vivanti. We have Buisman and Sheeran 2022, Autistic Person or Person with Autism, Person-First Language Preference in Dutch Adults with Autism and Parents. We have Dunn and Andrews 2015, Person First and Identity First Language, Developing Psychologists' Cultural Competence Using Disability Language. We have Dwyer 2022, Stigma, Incommensurability or Both, Pathology First, Person First, and Identity First Language and the Challenges of Discourse in Divided Autism Communities. We have Granello and Gorby 2021, It's Time for Counselors to Modify Our Language. It Matters When We Call Our Clients Schizophrenics versus People with Schizophrenia. We have Organization for Autism Research 2020, 1,000 people surveyed, a survey says. We have Tabois et al. 2022, Preferences for Identity First versus Person First Language in a U.S. Sample of Autism Stakeholders. And we have Waters et al. 2023, Language Matters, the Importance of Person First Language and an Introduction to the People's First Charter. Thank you.